So after the cell culture, now we see the roller tube cultures. Introduction. What are the roller tube cultures? These are grown in the test tubes for some tissue implants. Most importantly, the tissue implants are grown in the roller tube cultures and they are rotated. This is very important way that they need to be rotated all of the way during this infection or during this culturing. We will see them the procedure, and then we will see them the different kinds of the roller tube cultures, why we use them and how we use in different kinds of the methods which are used in the molecular biology or methods which are used in the virology. Tissue explants placed in the test tube. Of course, we already see that the roller tube cultures are used for the tissue explants. These tissue explants are first of all used put in the test tubes, and then these test tubes will be continue to be used as the roller tubes, and then small amounts of the plasma or the agar will be distributed over the inside the surface of the tube. Small amount of the plasma and the agar is always used for this roller tube cultures, and this will be after the tissue explants which are placed inside the test tubes, then the agar and the small amount of the plasma, and the fragments will be stay in its place. The fragments should not be rotated, or fragments should not be moved from their place at the time of the placing the agar or the plasma inside the tube. Here you can see the test tube. First of all, the slice is for the tissue explants. The tissue is placed here, just like you see in the slides. The tissue is placed in here, and then this slice, it is the tissue explant which is placed inside the test tube. Here is the glass cover slip which is placed. This is the black one, and this tissue explant should not be moved during the placing of the medium inside the. Then the cover slip, the glass cover slip, this is the treated on that, and here is the B where this is the slice. Here is the wells which are empty, and then the membrane for this, and then this is the tissue explants here, and tissue explants are here. How the tissue explants, tissue cells, the test tubes will do. This is the test tubes which have the tissue explants inside them. As the tube is rotated from, centrifugation is very important for this purpose, and after the rotation, after the centrifugation, the 8 to 12 rpm rotation per minute, the tissue explants will be submerged in the nutrient media, and only a portion of the time. Portion of time is very important, whether they are the centrifuge for the 10 minutes, whether they are centrifuge for 8 minutes, for 10 minutes, or for 20 minutes. As tube is rotated, then the tissue explants will be submerged, and submerging of the tissue explants is very important. Some cells will don't grow the satisfactory if they are entirely submerged. Of course, as we already see that submerging is very important. If the submerging is not very well done, then some of the cells will not grow. So you can see the time, it is the matter of the time, but the speed, you already know that centrifugation machines, most of the time they are about 12,000 rpm or not more than 12,000 rpm. So maybe it's a 14. So the time, you can increase the time according to your requirements, that whether the tissue implants, they are equally submerged. Other cells, especially those cultivated through the many transfers, will stick to the glass surface and grown when they completely submerged. So it depends on your own experiment that whether these cells are submerged or not. However, the submerging is very important from this specific kind of the culture.